What role do you think education providers play in embedding cultural safety in the healthcare system?
Given that education providers' role is about making a contribution to the society and in this context for Australian society, unless they commit to actually embedding cultural safety in all of our undergraduate health professional programs, I would challenge that they're actually meeting that commitment of addressing needs in our society, especially given that Aboriginal and Torres Strait Islander people are overrepresented on every social indicator, that they might be contributing to a society, but they're not contributing to all of a society, and they're not contributing to the most vulnerable people within our society unless they make cultural safety a key element of our education programs.
Why is increasing the Indigenous representation in the health workforce important?
Given that to my previous point, given that Aboriginal people are overrepresented across Australia's healthcare system, its basic good policy and program development is to involve the people that are most impacted on the outcomes. So given that we're working to address the inequalities that exist between Aboriginal and non-Aboriginal people, you have to have Aboriginal people involved in developing the solutions in order for them to have buy-in and then sustainability of those outcomes. Another point around that is most people are looking at equity, so most people are going for the 3% rule or the 2.5% rule, depending on where you live. But if you look at the over-representation, and as an example, if we looked at renal units or cardiac units where Aboriginal and Torres Strait Islander people are up to 5, 6, 7, 8 times more likely, we need to be raising the bar to above 2.5%, 3%. And also acknowledging the value of Indigenous knowledge in developing solutions for what is one of Australia's greatest challenges. And the final comment, involving Aboriginal people is about self-determination, and that's a fundamental principle of the United Nations Declaration of Indigenous Rights.
So it recently conducted a survey across all of the accredited programs within the national scheme.
Yeah.
We had 218 responses, and it focused on two different areas: how we encourage Indigenous students to apply for health education programs,
yep,
and ensure that they are supported throughout those programs,
yep,
and also the extent to which our programs are producing a culturally safe health workforce.
Yep.
So in regards to the first area, does Griffith or any other program have any specific pathways for Indigenous students, and what do you do to encourage them to continue with their studies?
Yeah. Our biggest challenge across all the health programs is not the recruitment. So the evidence will tell us that health is one of the biggest draw cards for Aboriginal and Torres Strait Islander people into university. So that's not our issue. Our issue is actually retaining students, which is why we need to focus better on retention and success. Most universities have a pathway. Griffith University has a pathway, an equity pathway into all programs across the university, and we have a second pathway for high demand programs, of which dentistry is included in that, and it provides a 2 OP tolerance, or whatever the OP is, to come into the program. And that's because it acknowledges the disadvantage of which some Aboriginal and Torres Strait Islander students might come into it, but it also has a secondary impact in that it acknowledges the Aboriginal and Torres Strait Islander knowledge that Aboriginal students actually bring into the program as well. And it's that knowledge that we're then attempting to teach non-Indigenous health professional students. So we're actually getting it from one while we're teaching the other part of the cohort. So retention and success need to be our main factors, and certainly one of the programs I've heard of is the Posh Institute at Sydney University is developing a pathway down there, but I'm unsure of the details, Narelle. Yeah.
I think that's a really good point, that what Aboriginal and Torres Strait Islander students can bring to the program affects the other side of my question, which was about producing a culturally safe workforce. So there's absolutely lots to learn from each other, I think. Yeah.
And certainly in my experience as a health professional and working within the university, the best learning that can take place is when you've got an Aboriginal and a non-Aboriginal health professionals working alongside each other.
Yeah, great.
Yeah.
So recent survey data indicates that there's less than 1% Indigenous students in dental programs and absolutely none in our specialist programs.
Yep.
What do you think that the profession can do to increase the number of Indigenous students in our programs?
Yeah, I think the profession is definitely making the right steps in the work that you're doing around the review of the accreditation standards. One of the pitfalls that most people fall into when they're attempting to committing to addressing this issue is developing a number of strategies without an overarching strategy that brings all of those initiatives together. So my advice to the Australian Dental Council or anyone who wants to work in this area is to actually develop a strategy to bring all your multiple pieces of work together. Otherwise, you run the risk of doing all of those without an overarching strategy to drive or to help you to achieve whatever your outcomes would be of that strategy. So this would include things like your program accreditation standards, your professional standards, engagement with Aboriginal and Torres Strait Islander people. That would be individuals, it might be with organisations as well, with communities. It may also be your reconciliation action plan. So one overarching strategy would bring all of these individual strategies in together